Hello, and welcome to this community forum. My name is Jennifer Spitolnik. I'm a health educator with Columbia Boone County Public Health and Human Services, and I'll be moderating this conversation. We're grateful to be joined by two medical experts from our community who are here to answer your questions about COVID-19 vaccines. Our panelists tonight are both physicians at MU Healthcare. Dr. Christelle Ilbudo is a pediatric infectious disease specialist, and Dr. Carol Silney practices family medicine. We also have a Kinyarwanda interpreter joining us on this call, as well as other interpreters on site at Catholic Charities. Before we begin, there are a few important facts about the vaccine you should know. First, the vaccines are free to everyone. You will not be charged a fee. Second, you do not need to have health insurance, and you do not need to show official documents. That means you can get vaccinated no matter what your immigration status is. Finally, the vaccine is halal, and it's okay to get it during Ramadan because it will not break a Ramadan fast. And with that, we'll open the discussion for your questions.
Ramadan or is fasting, is he allowed or to take a vaccine or is not allowed?
Is allowed.
Ngo nta kibazo yarufata.
Sinsobanukiwe yarufata gute waruvuze ngo ategerezwa gufata ngo urukingo ngo ari mu bisibo ibyo bisibo ndi twabitesobanukiwe.
Ibisi interpreter kalifang ibisi bavuga ni iby'abayisilamu bya Ramadan.
Okay.
Yes, I got it, ma'am.
Thank you. All right. We're going to go ahead and open it up for any questions that you have.
Nta kibazo ubwo ibibazo birakomeje ufite ikibazo yakibaza.
Ufite ibibazo bigera kuri bibiri. Ikibazo cya mbere kirabaza ngo ese nyuma yo kumva ko urukingo nta kibazo rufite nta n'ingaruka rutera hariho inkingo zingahe. Icya kabiri ubu nyine guhera uno munsi umuntu aba yemeye gutera urukingo yarufata ryari akazasubirwa kabiri ryari.
So like after understanding that there is no side effect of a vaccine and it is okay, someone can take the vaccine. So I'm asking like what is the period maybe after taking the first vaccine? What the period between the first dose and the second dose for the vaccine?
Dr. Abudo, you want to go?
Sure. And that's a great question. And to go back on what Jennifer was talking about earlier, the vaccine does not break your fast. So if there's worry about Ramadan and the fact that you get an injection, know that it does not count as one of those things that breaks your fast. For the duration,
aravuze ngo rwose kuba umuntu ari mu gisibo wenda nka biriya by'abayisilamu ntago rwose kuba yarufata urukingo ntacyo bihinduraho ntacyo binatwaye rwose.
As far as the time between the doses, it is either 21 days or 28 days, depending on which vaccine you get.
Mbeho umuntu tuvuga wenda ufashe urukingo rwa mbere hashobora gucamo iminsi 21 kugeza ku minsi 28, ariko narwo biterwa n'urukingo ubwoko bw'urukingo wafashe.
Okay.
All right, we can take another question. Please feel free to put them in the chat or to ask in the room that you're in.
Nta kibazo twafata ikindi kibazo umuntu waba ufite ikibazo yakivuga.
We also have some questions that were sent in advance, so I'm going to go ahead with one of those. So the first question, I'm sorry, go ahead.
No, I was giving the thumbs up. Yes, please do that.
Okay. The first question is, Can we expect to have 3 shots of the Pfizer? Is there any update on successful percentage between Moderna and Pfizer? I guess that's 2 questions.
Well, this is
But
Dr. Stilney.
I think we need to wait for the translation.
Okay.
Sorry.
Mhm.
Okay. Ma'am, you're asking the question, is it okay to take 3 shots of Pfizer or Moderna?
No, should we expect that there will be a 3rd shot? So right now there's 2. Should we expect that in the future we'll have to get another one?
Barimo barabaza ngo ubu ngubu nyine ku bijyanye n'urukingo rwa Pfizer na Moderna barufata inshuro ebyiri, noneho barabaza se ngo twitegure yuko wenda bashobora kuzaza nayo urundi rwa gatatu nyine rwiyongera inshuro 3 mbehe umuntu bamutera urukingo. Tubyitegeye ko wenda umuntu bashobora kumutera inkingo inshuro 3 urukingo rumwe.
Everyone.
Yes, this is Dr. Stilney. Because the vaccine and COVID infection is so new, there is a lot of work that is still being done, learning about how long this vaccine can protect us.
Kubera yuko nyine mu by'ukuri n'izi nkingo zose baba bakibyigaho, n'ubu ngubu barimo bakibwaho nyine tuvuga wenda ni izi nkingo se dufata wenda zaduha ubudahangarwa cyangwa zaturinda wenda igihe kimara iki, birakigwaho ntabwo biremezwa.
So there is a possibility. I think Pfizer is looking into the possibility of a 3rd vaccine, but I don't know at this point that we know that. Do you, Dr. Abudo?
Pfizer niyo barimo barimo bigaho wenda ku buryo wenda abantu bafata urukingo nanone rwa gatatu.
Okay, twabyumvise. Twabyumvise, twavuga ko twabyumvise rero ubwo twumvise ni sawa.
Mwabyumvise?
Yorekera aho ngaho ntaco twumvise.
Okay, we got it.
Dr. Abudo, did you want to add anything or also?
I agree with Dr. Silne. It's too early to tell. We also have to keep in mind that our bodies and immune systems is very smart. And so far, even if the numbers are saying that the vaccines do not work well against certain variants, our bodies are able to protect us as far as we know so far.
Ngo nubwo wenda inkingo wenda zitarizerwa kuba wenda zaturinda 100%, atariko icyo twizeye nuko nanone imibiri yacu igifitemo za mbaraga zo kuba nayo yarwanya bwa burwayi.
But if the concern really is that if we have the different variants that merge together, then you have a virus that is entirely different from the original. And I think that's where the debate lies, as Dr. Silne mentioned earlier.
Kubera yuko nyine n'ubundi iriya noza ihindagurika, COVID ihindagurika, ngaho wenda niho bakwibanda nanone bakareba bakongera kubyigaho nyine uburyo nyine inoza COVID igenda ihindagurika.
Okay, we have another question that's come in. If we're ready in the other. Oh, I'm sorry. Go ahead.
No.
Haba hari ikindi kibazo?
Okay. A friend of mine said that the vaccine might cause us to feel sick for a period of time. Is that true?
I'm sorry, ma'am, could you repeat that?
Of course. A friend of mine said that the vaccine might cause us to feel sick for a period of time. Is that true?
Inshuti yanjye nyine yarambwiye ati ngo urukingo rushobora kumutera wenda kurwaraho igihe runaka, ngo se ibyo byaba ari byo?
yego.
So
Yes,
most,
it is true.
yes, it is true. Most vaccines, when you take it with your immunity trying to recognize the vaccine, you may have reaction that make you feel that you're sick. But in reality, it's actually your immune system priming and getting ready to protect you against, this infection in the future.
Kubera yuko nyine impamvu wenda umuntu ashobora kurwara ni kwa kundi nyine umuti cyangwa rwa rukingo rwinjira mu mubiri, noneho rugasa nk'aho rusembuye wenda uturemangingo cyangwa abasirikare b'umubiri, noneho bakarugiraho reaction barwana n'uburyo nyine baza mbehe ku buryo nayo ndwara nubwo yaza nyine abasirikare bakaba biteguye ku buryo barwana na cya cyorezo. Noneho iyo umuntu bamuteye urukingo nyine umubiri kenshi na kenshi ukunda gukora reaction nyine ya wa muti bamuteyemo ya rwa rukingo.
Is the vaccine safe for pregnant women?
Ese ngo urukingo rwaba wenda nta kibazo wenda rwateza ku muntu utwite?
Yes, it is. So the initial studies excluded pregnant women.
I'm sorry, you mean that it may affect the pregnant woman in the initial stage?
No, I mean that, yes, pregnant women can get the vaccine.
Aravuga nta kibazo rwose abantu batwite babona urukingo ntacyo bitwaye.
The initial studies did not include pregnant women. So that's why when the vaccine first came out, there was no clear recommendation around pregnancy.
Kubera yuko n'ubundi tutakoze ku bushakashatsi, urukingo wenda ruje ngo dukore ubushakashatsi se wenda baruteye umuntu utwite hari icyo wenda ingaruka zamugeraho, ibyo ntabwo twabikozeho ubushakashatsi, niyo mpamvu rero n'abantu tunabatera batwite.
But as they started collecting data after the vaccine came out on pregnant women, so far it is a very safe vaccine for pregnant women to get.
Kuva urukingo rwaza ubu ngubu ntacyo rwose rutwaye ku bantu batwite, ntacyo rubatwaye.
Thank you. Can kids get the vaccine?
I'm sorry?
Can children get the vaccine?
Ngo ese abana bafata urukingo wenda?
Well, initially, children were not included in any of the studies. The youngest kid that were included was 16 years old for the Pfizer vaccine. Is that right? Pfizer, 16. So at this point, no, kids cannot get the vaccine.
Aho kugeza kuri ubu ngubu rero abana ntabwo bemerewe gufata inkingo, gusa ngo wenda nko ku rwa Pfizer nibwo wenda abana b'imyaka 13 imyaka 16 bo barufashta rwose nta kibazo.
Actually, now they are doing studies and investigation and getting younger kids vaccinated to see how they're gonna react and receive the vaccine. So in the future, we're certainly gonna have children as well.
Ubu ngubu barimo baracyakora ubushakashatsi nyine ku buryo wenda no mu minsi wenda iza abana nabo bababonera urukingo, ariko kugeza ubu ngubu ntabwo abana baremerwa gufata urwo rukingo rw'ikonoza rw'iki cyorezo.
Thank you. Another question we got, how do people react to the shots?
ngo se abana nako abantu ni gute wenda bakira urushinge wenda babateye nk'urushinge cyangwa urwo rukingo?
So it's just like any other vaccines that you get.
Ni nk'ibisanzwe, ni nk'uko wenda n'ubundi wafata urundi rukingo, niko abantu babifata rwose.
A lot of people have a little bit of pain at the site where they get the injection.
Abantu benshi wenda bakunda kumva ububabare iyo barimo kubatera nyine urushinge.
Some people have muscle aches and headaches that last 24 hours to a couple of days.
Abantu bamwe bumva wenda bababara umubiri, bababara n'umutwe, bishobora no gufata wenda iminsi.
And there are very, very few people who are sicker, meaning that those symptoms are heightened or more as far as severity than other people.
I'm sorry, ma'am, could you repeat that?
I said, and very few people will actually have a worst outcome in those symptoms, that they have more severe headaches, more severe muscle aches, more so than the general population.
Just a
Okay,
very
thank
few.
you. Ngo abantu wenda benshi ntago ari abantu benshi bikunda kubaho wenda kumva barwara umutwe, bagira ibyo bimenyetso wenda cyangwa ingaruka zo guterwa urushinge. Ntago biba ku bantu benshi, ni abantu bake bigenda bibaho.
But what I recommend is that the day you get your vaccine, to let the person giving you the vaccine know if you have any health conditions whatsoever, including allergies, because then they can really counsel you on what to expect.
Icya mbere wenda nk'umuntu ahantu wenda umuntu uzaba ugiye kuguhereza urwo rukingo, icyiza ni uko wamumenyesha mbere. Tuvuge wenda nimba ugira nka allergie cyangwa icyo twita amahumane mu Kinyarwanda, cyangwa indi ndwara iyo ari yo yose, ukabimumenyesha mbere yo kubona urukingo, ku buryo wenda haba hari n'indi nama wenda yabikugira, byakugirira akamaro.
Especially anybody who has a bad enough reaction that they need an EpiPen, they definitely need to let the person or the person vaccinating them know what type of reaction that was and why they needed an EpiPen.
EpiPen?
Yes, epinephrine. It's Dr. Silny, I don't know if there's another word for it.
That's the only word. It's a shot that you take to prevent you from getting a bad reaction from a medication or from a bee sting.
Okay,
or something like that.
Okay, thank you. Wenda tuvuge wenda nk'umuntu ufite wenda ibyo bibazo bamuteye ufite wenda nk'izaraje cyangwa amahumane, umuntu wembe urukingo rugiraho ingaruka, hari urundi rushinge wenda bashobora kubanza kumutera kugira ngo wenda za ngaruka zishobora guterwa n'urukingo nizimugereho.
Thank you. Does the vaccine... Oh, sorry.
Go ahead. I was going to say that there is a small minority of patients who may have a delayed reaction. It doesn't happen right away after the shot, the vaccine. They may feel it maybe a week later, but most of the time it's a local reaction at the site of the shot.
Ngo bisanzwe nyine wenda nk'umuntu iyo bagiye kumukingira wenda iyo ari gukingirwa, ngo mbehe reaction nyine uburyo kwa kundi umuntu wajya kumutera urushinge nyine uburyo wenda yifatamo, ngo ni abantu benshi nyine ubundi rukingo ruba rubisanzwe nyine nk'uko wajya kugutera urushinge cyangwa gufata urundi rukingo, ni ibintu biba bisanzwe, ntabwo ari ibintu biba birenze.
Thank you. Does the vaccine affect individuals with health issues?
ese ngo urukingo rwaba wenda hari ingaruka rwagira wenda ku buzima bw'umuntu se wenda afite n'ibindi bibazo by'ubuzima?
I'm not sure what health issues they are referring to. Any more specificity about that? Anything more specific?
Wenda umuntu kugira ngo bisobanuke neza yavuga wenda se uwo muntu yaba afite nk'ikibazo cy'ubuzima kihe cyangwa se uburwayi buhe?
The question came in.
You're not sure. I would say
Oh,
that
I'm sorry. Health issues like asthma.
asthma. Mhm.
Ngo umuntu ufite ibibazo wenda tuvuge nk'ibya asima cyangwa by'ubuhumekero.
I do not believe that the vaccine has any specific reaction to someone who has asthma. Actually, people with asthma are at higher risk if they were to get the virus, and they really need to get vaccinated.
Kubera yuko n'ubundi nyine abantu wenda bafite ibibazo bya asima cyangwa indwara ya asima nyine biba byiza yuko ahubwo bo biba ari na byiza yuko baba mu ba mbere bafata urwo rukingo kuko baba bafite ibyago byinshi byo kwandura, rero barufashe hakiri kare bo byabafasha.
Dr. Obudo, did you want to add anything, or should I ask the next question?
I think Dr. Silney covered it.
Okay. Can a woman who's breastfeeding take the vaccine?
Ese ngo wenda umudamu urimo wonsa yafata urukingo?
Yes.
Yego, umudamu wonsa rwose yafata urukingo.
Okay. Can you spread COVID after getting the vaccine, and do you still need to wear a mask?
Ese ngo wakwanduza COVID umaze gufata urukingo cyangwa se waba ukeneye no kwambara agapfukamunwa ni ngombwa?
Absolutely. The vaccine protects you from severe disease, hospitalization, and maybe death from COVID, but you can still potentially get it and give it to other people. Yes, you need to wear masks.
Yego, nibyo rwose, umuntu wafashe urukingo ashobora kwandura kandi ashobora no kwanduza, cyangwa urukingo rwo rumufasha wenda ku buryo rutamwica, ariko mu by'ukuri abashobora kwanduza akanandura, kandi biba ari byiza yuko nyine akomeza akambara n'agapfukamunwa kuko biramufasha.
And I know sometimes that can sound defeating, but the other reason is that we need to get enough people vaccinated to protect all of us, and we are not there yet. There is a hope that we will get to that point where enough people are vaccinated and we see less and less and less infections. And at that point, we can talk about when and how the masks can go away.
Mu by'ukuri icyo twifuza ni uko byibuze abantu benshi bafata uru rukingo kugira ngo tugabanye ubukana bw'iki cyorezo. Byaba byiza rero mu by'ukuri kugira ngo tugice intege abantu bose bagiye bafata urukingo.
But if I could ask a clarifying question, there's evidence that it does prevent a certain amount of transmission, right?
Yes.
Ndimo ndabaza ikibazo ngo gukingirwa ngo bigabanya mbehe nyine ku kigero wenda runaka cyo kwanduza, nibyo?
Yes, but those studies are limited so far. That the most that I've seen are in healthcare workers, which is different because healthcare workers really know how to wear a mask well because you are trained to do that.
Nibyo pe, ubwo bushakashatsi buracyakorwaho, ariko mu baforomo cyangwa mu baganga wenda nibo turimo kugira, nibo bagerageza kwambara iyo masiki, kandi nibo tubona nyine muri bo wenda bisa nk'aho bigabanuka cyane nyine mu buryo bwo kwanduza buragabanuka cyane.
So yes, we have evidence that with the vaccine, you are less likely to pass the virus on to other people, but the studies are very limited for us to make that as a generalizable to everybody type of application.
Mu by'ukuri byo biba bikigwaho, ntabwo tuba turabyemeza ngo twenda tubihamye cyane yuko umuntu wakingiwe nyine atashobora kwanduza, ariko turabyigaho tubona yuko nyine umuntu wakingiwe yanduza ku kigero runaka, ariko bitabujije yuko mu by'ukuri atabasha kwanduza abandi.
Yeah, I really believe the most important lesson is to know that once you've had the vaccine, you're not 100% protected. You could still get the virus and you could potentially still can give it to someone. So until we get this herd immunity where everybody is almost vaccinated and the virus cannot go from one person to the other, we still should be mindful, wearing masks and protecting each other.
Mu by'ukuri nibyo, mu gihe umubiri wacu utaragira wenda ubudahangarwa, abantu wenda batarafata izi nkingo z'iki cyorezo, kugira ngo imibiri yacu nyine igire imbaraga wenda ibashe kukirwanya, ni byiza yuko buri muntu wese yakomeza akirinda, akambara agapfukamunwa, agakomeza nyine kurinda na bagenzi be.
So going along with that, we have a question here. People who can't get vaccinated for any reason, such as immune condition, although that's, well, what should they do in order to not get infected?
Ese nk'abantu tuvuge bafite ikibazo wenda cy'umubiri, nako cy'umubiri wenda kwa kundi umubiri ufite urwanya nyine indwara, ufite ubushobozi bwo kurwanya indwara, ni gute nyine byakorwa kugira ngo buri muntu nyine abashe kugira umubiri nyine ufite ubudahangarwa bw'indwara y'icyorezo?
Yeah, they should wear their masks. They should avoid crowded situations, travel places where there are a lot of people that they don't know. They should practice safe distancing and good hand washing.
Mu by'ukuri abantu bataragira umubiri nyine cyangwa ubushobozi bwo kuba barwanya umubiri wabo warwanya iki cyorezo, bose bagomba kwirinda nyine amabwiriza yose, kujya mu ngendo zitateganyijwe, kujya mu bantu benshi nyine aho bateraniye, agakomeza akambara agapfukamunwa, agakomeza kwirinda iki cyorezo kuko mu by'ukuri icyo kiracyahari. Icyo nicyo cyafasha wa muntu nyine ufite umubiri ufite ubudahangarwa bukeya bw'umubiri.
And how long does protection from a COVID-19 vaccine last?
Ese ngo wenda urukingo iyo umuntu arutewe, uburinzi bwarwo bumara igihe kingana iki mu mubiri?
That is a great question, and we are learning as we go. We have data that it protects for at least 6 months.
Icyo ni ikibazo cyiza mu by'ukuri, kandi turacyabyigaho, ariko kugeza ubu ngubu ubushakashatsi dufite ni uko umuntu abasha kurindwa mu gihe cy'amezi 6.
And the reason for that is that that's how old the studies are, and that's how much data we have. So it's not to say that it doesn't protect longer, we just don't know yet.
Mu by'ukuri si uko wenda tuvuga ngo ntabwo wenda urukingo rurinda igihe kirekire, ni uko mu by'ukuri natwe tutarabimenya, niyo n'amezi 6 naracaho, rero natwe turacyabyigaho. Si ukuvuga yuko wenda rutarindiye n'igihe kirekire umuntu, ariko ni ibintu n'ubundi tukigaho, tuzakomeza tugenda tureba dusohora amakuru, kugeza ubu niyo makuru dufiteho ku bijyanye n'uburinzi bw'urukingo rubasha kumara mu mubiri.
So I want to ask the question, if we still need to wear masks, etc., why should we get vaccinated? What's the benefit?
ese nimba tubasha gukomeza kwambara wenda agapfukamunwa ni iyihe mpamvu wenda umuntu akomeza nyine kugira kwa ni iyihe impamvu umuntu akomeza yafata urukingo?
I think that's a good question. I think mask doesn't give us complete protection. When we put the vaccine, we get a little bit more protection. And eventually with the vaccine, if everybody can get vaccinated, or we have a good portion of the population vaccinated, we can maybe defeat that virus. We can be weasel out.
Mu by'ukuri kwambara agapfukamunwa ni byiza, kandi no guterwa urukingo nabyo ni byiza ko byongera kukurinda nyine ibyago byo kwandura iki cyorezo. Ni byiza yuko n'abantu bose abantu benshi bakomeza gufata urukingo, kuko byadufasha kugira ngo kino cyorezo tugice n'intege tunagitsinde.
And the vaccine definitely keeps us out of the hospital. I'd rather get the vaccine and have a mild headache than get COVID and end up on the ventilator in the hospital.
I'm sorry, ma'am. Could you repeat that question?
I said, and the vaccine also keeps us out of the hospital. I'd rather get the vaccine and have a mild headache rather than getting COVID and being intubated in the hospital.
Byaruta nkabona urukingo wenda nkagira uwo mutwe wenda n'uwo mutwe ukandyamo, ariko wenda n'izo ngaruka zo kugira umutwe bizikambaho, kuruta wenda uko nakwandura icyorezo nkajya mu bitaro nkaremba.
And the other point with that is that even for people who do well with COVID, we are seeing a lot of them have what we call long COVID syndrome.
Mu by'ukuri n'abantu wenda babasha kurwanya tuvuga iki cyorezo, tubasha mu by'ukuri kubona wenda hariho ingaruka cyangwa ibimenyetso bigaragaza nyine iki cyorezo kibarimo cya COVID by'igihe kirekire nyine.
And those are, people having really brain fog for a long time. Some people have really bad heart disease because they had COVID. We know of some patients who actually died a couple of weeks after they got over the COVID at home from a heart attack.
Mu by'ukuri hari abantu barwara imitima, abantu bapfa kandi bavuye mu bitaro. Ibyo ntibyo mu by'ukuri ingaruka za COVID.
Yeah, I think Dr. Abudo is right. I feel that having had COVID infection become almost like a pre-existing condition. So this is something that's gonna follow people who have had COVID.
Turashima umuganga ibyo amaze kutubwira. Mbehe ibi ngibi nibyo bimwe byadufasha gukomeza gukurikirana umuntu wigeze wenda wanduraho kuri icyo cyorezo. Ni nkayo nama cyangwa ubufasha wenda yakomeza n'inama wakomeza kumugira nk'umuntu wigeze kwandura icyo cyorezo.
Thank you. Here's another question. For the people with immune problems, is there a certain type of vaccine that they can or cannot get?
Wenda abantu bafite nk'ibibazo by'ubudahangarwa cyangwa by'ubudahangarwa bw'imibiri se bukeya buri hasi, hari inkingo zagenewe se bagomba gufata n'izo batagomba gufata?
Yeah, people with immune conditions, we believe that sometimes they cannot really mount a good response or build a good immunity from getting a vaccine.
Tuzi mu by'ukuri abantu bafite ibibazo tuvuga wenda by'ubudahangarwa bw'umubiri wenda buri hasi, biragora cyane kugira ngo umubiri wabo wubake ubudahangarwa bw'umubiri.
So these people may not benefit as much from getting the vaccine than someone who doesn't have an immune condition.
Wenda bashobora no kuba batafashwa cyane n'uru rukingo, aba bantu bafite ubudahangarwa bw'umubiri buri hasi kuruta wenda na wa muntu nyine ufite ubudahangarwa bw'umubiri buri hejuru.
We really think that some vaccine like that are made from live viruses can sometimes make people with immune conditions sick. So they sometimes cannot get those vaccines.
Abantu wenda bafite ikibazo cy'umubiri w'ubudahangarwa uri hasi, hari nk'inkingo wenda batabahereza, zimwe wenda ziba zarakozwe mu mavirusi, akenshi na kenshi ntabwo bazihereza kubera yuko n'ubundi umubiri wabo ufite ubudahangarwa nyine bukeya buri hasi.
So COVID vaccine is not a live virus vaccine. Therefore, we believe most people with immune conditions should be able to get it.
Kandi nyine ko urukingo rwa COVID wenda ntabwo ari virusi nyine twavuga iba ari nzima, umuntu uwo ari we wese yarufata.
I agree that it's still beneficial to get it, even if the immune system is not up to par. But I would check with the doctor who is helping them with the immune system disease or illness to make sure that their particular immune condition would be one where we would recommend the vaccine.
I'm sorry, ma'am. I didn't hear that.
Yeah, I said I agree with Dr. Silney. And what I would advise on top of that is if somebody is really concerned, they should talk to the doctor who's taking care of the immune system illness to make sure that they address all of their concerns.
Mu by'ukuri abantu wenda bafite ibibazo by'ubudahangarwa bw'umubiri bareba nka muganga wabo bakabimumenyesha kugira ngo nyine abagire wenda inama mu buryo babyitwaramo.
Are there any conditions where you would say don't get this vaccine?
Haba se wenda hari impamvu zindi ku buryo umuntu nyine ashobora kuba atafata runo rukingo?
Not aware of one, are you, Dr. Abuda?
I don't think so either.
Ndumva nta mpamvu rwose ihari yatuma wenda umuntu atafata urukingo.
The only contraindication is if somebody has a severe allergic reaction to one of the components of the vaccine.
Impamvu wenda imwe ihari yatuma umuntu atafata urukingo ni uko wenda afite ikibazo cy'amahumane cyangwa ibyo twita allergie mu nkingo zimwe na zimwe.
So, okay, great. Another question came in. What should we do if we are scared to get the COVID vaccine because we don't know enough about it yet?
Ese twakora iki mu gihe wenda dufite ubwoba bwo kuba twafata urukingo ari nta n'amakuru ahagije turufiteho?
Your primary care doctor, your medical provider, someone you trust, you can go to them and talk to them to help you make that decision to learn more about the vaccine.
Mu by'ukuri ushaka kuba wenda wamenya amakuru ku bijyanye n'iby'uru rukingo cy'urushidikanyaho ufite amakuru yarwo neza, ushobora kureba primary doctor wawe cyangwa muganga wawe usanzwe, cyangwa ukajya wenda se no ku bitaro ahantu ubona bagufasha bakakugira inama bakaguhereza amakuru wenda ku bijyanye n'uru rukingo ku buryo nyine wajya kuruterwa urufiteho amakuru ahagije kandi nawe wumva nyine uhamanya nabyo.
And the health department and the family health center also have great resources for information that can be available in different languages as well for you to understand.
Kandi nyine biri mu nde hariho nyine ibigo by'imiryango cyangwa by'amadepartement agiye atandukanye bifasha nyine ayo mabwiriza nyine wenda y'amakuru ya covid aba ari mu ndimi zigiye zitandukanye. Umuntu wenda wabisaba ukabibona ku buryo nyine wabona ayo makuru yose ajyanye n'uru rukingo.
All right, well, we are nearing the end of this hour. So I'm just going to ask our panelists if there's anything that that they want everybody to know, any last things that they want to say and want to impart.
Twabaza abatumirwa bacu nimba wenda hari umuntu hari uwaba icyo afite yabaza.
I think for me, the message is, to be careful about where you get information from. Make sure that you are talking to somebody who's qualified, like a medical professional or somebody at the health department or the family health center who can really explain to you the differences between COVID illness and the vaccine and the do's and don'ts and how to get it, to really make that informed decision for yourself about the vaccine.
Mu by'ukuri wenda inama nagira cyangwa icyo navuga nuko wenda umuntu yajya ashaka wenda mu makuru ku baganga, ku muganga wawe se mbehe ku bantu bizeye ku buryo baguha amakuru ajyanye n'uru rukingo, mu bantu wizeye nk'umuganga wawe cyangwa n'ahandi, ku buryo nyine nubwo hari amakuru acicikana yenda agiye atandukanye, ariko byaba byiza ukabona amakuru yizewe ajyanye n'uru rukingo ku buryo warufata nyine nta mpungenge mu by'ukuri ufite.
My recommendation is for everybody to really try to get the vaccine for their own protection and the protection of their loved ones. I think we all in the medical community, we already had the vaccine. We're all doing fine. We continue to care for the community and for people. And I'd like to see that everybody can get that protection. So I strongly recommend they get the vaccine.
Kandi icyo nasaba wenda buri muntu wese mu by'ukuri nuko wagenda ugafata uru rukingo kugira ngo urinde n'umuryango wawe, urinde n'abaturanyi bawe n'abavandimwe aho mutuye muri quartier. Nicyo numva nabasaba mwakora nyine nk'abaturage.
Thank you. And Dr. Obudo, you said something last week that really stuck with me about the difference between having a shield and getting battle scars. Can you just tell us about that a little bit?
Having a what, Mama? I didn't get that question.
I'm sorry. Dr. Obudo had said something last week, and I was just hoping she could share that again. So maybe that part doesn't need, maybe we can just let her talk.
Muganga Budo, hari ikintu uheruka kuvuga icyumweru gishije wakongera ukakituganirizaho?
So what I tell my children about vaccine, like every year we have to get the flu shot, is this. You see Wonder Woman, you see Captain America, they have a shield, and the shield allows them to avoid things that are coming at them while they are fighting enemies.
Icyo nkunda wenda nkubwira abana banjye ni ukuvuga ngo bakunda kureba nk'amafilime wenda arimo Wonder Woman bafite nk'ingabo ibakingira nyine. Mu by'ukuri ibyo ngibyo nanjye nibyo nifuza kubabwira nanjye wenda kugira ngo mbehe asansa bivugiramo, ni nko kuvuga ngo ruriya rukingo narwo ni nk'ingabo wenda ishobora gukingira umuntu nyine wari umuntu ufite icyo kibazo ushaka wenda ufite icyo kibazo cya COVID.
And this is what the vaccine does for you. It allows you to go into battle or out there knowing that you're not going to get injured by the virus.
N'uru rukingo rwose nicyo rukora narwo rukora nk'ingabo cyangwa rukagukingira ya virusi cyangwa za ndwara ku buryo wajya ahantu hose umeze nk'uri mu ntambara ariko uzi yuko nyine ukingiwe wese ku buryo nyine nta cyakwataka cyangwa iyo ndwara cyangwa ubwo iyo virusi mu by'ukuri itagira ikigutwara kubera urukingo nyine uba wafashe.
So I'd rather go into battle with a shield and a spear than with just a spear alone. So the spear is your mask and the shield is the vaccine.
Rero buriya agapfukamunwa ni nk'icumu kandi urukingo ni nk'ingabo ishobora kugukingira. Rero mu by'ukuri byaba byiza umuntu agiye ku rugamba afite urukingo wenda akagira n'iryo akagira ingabo akaba afite ingabo afite n'iryo cumu. Byaba byiza mu by'ukuri natwe rero ibyo bintu tubigize tubifite.
Thank
That
you.
is a great analogy. I think I'll steal it from you.
Thank you both so
Okay.
much. Oh, sorry. I did want to let everyone know about some upcoming opportunities to get vaccinated.
Ndenda buri umwe wenda nashaka buri umwe kumenya ku bijyanye nyine n'urukingo wenda cyangwa nduri buze.
So if you do choose to get vaccinated, it's very easy now.
Nimba umuntu wenda ushaka gukingirwa ubu ngubu biroroshye ntabwo bikigoranye.
So tomorrow, Boone Hospital will be at Columbia Mall pretty much all day.
Bruno ejo azaba muri sale ya Columbia.
And then on Saturday, MU Health, Boone Hospital, and the health department, we will all be together in Indian Hills Park to do a clinic there.
Kuwa gatandatu tuzaba turi nawe muri Indian Park nyine kuri ka clinic gahari tuzaba turi kumwe nanone nawe aho ngaho niho tuzabikorera.
And then at the clinic at the health department on Worley Street.
Nanone kuri clinic kuri Wall Street clinic aho ngaho.
We have appointments available every day next week.
Dufite amarandevu rwose ahari ya buri munsi guhera wenda no n'icyumweru gitaha.
And you should know that at the health department, we never ask for ID or health insurance.
Kandi rwose hano ntago dusaba siranse nta nubwo dusaba wenda nk'irangamuntu cyangwa ID y'umuntu uwo ari we wese.
The vaccine is also available at pharmacies like Hy-Vee, Walmart, and D&H.
Urukingo ruboneka kuri Walmart. Could you repeat the name of those area?
Yeah, Hy-Vee, Walmart, D&H. Also flows, I think.
Okay. Urukingo kandi ruboneka ahantu kuri ahitwa ngo ni Hy-Vee na D&H n'ahantu hitwa Walmart.
It's easy to get an appointment, but they often ask for insurance and ID, just so you know.
So you mean they ask for the insurance or they don't?
They do ask for insurance, even though you don't have to have it, but they will ask for it. So it might be harder to make an appointment. That's all.
Wenda bishobora kugorana kubasaba noza rendezvous kuko wenda bo basaba nka silence bagusaba silence.
Okay. So thank you, everyone. If you have more questions, please get in touch with us but at this email, covidvaccine@como.gov, or by calling the number on the screen, which I'll repeat after translators had a chance to translate that.
Mwakoze cyane mwese abaje, gusa nyine hari email iri aho ngaho kuri nuza kurekara aho ngaho na nomero za telefone ziri aho ngaho, ubwo umuntu waba ufite ikibazo nyine yazitwara akazanabaza, wenda yaba afite ikibazo akazatubaza.
It's 573 874 2489.
Nomero ni 573 874 2489.
Okay. Thank you so much, everyone, for joining us. And thank you so much to our panelists and all of our translators on site and on the phone. We really appreciate you and your work.
Thank you.
Mwakoze cyane mwese abaje kandi turabashimiye.